Hi, this is the treatment group video for sexual masochism. My name is Casey Dahl and my client's name is Carla Jessup. My client's story, or the differential diagnoses I have for this client are sexual masochism and sexual sadism. Sexual sadism was ruled out because it didn't meet all the criteria. So sexual masochism was ruled in. The primary diagnostic features I have for this client are that the sexual urges, fantasies, or behaviors involving being humiliated, beaten, bound, or made to suffer, and sexual urges have been present for at least 6 months. So the client's story is that she's a 28-year-old nurse who's been with her husband since they graduated college, and for Carla's job, she makes more money than her husband does, and they fight about this a lot, and one day the fight got very violent, and he ended up hitting her. He slapped her across the face, and ever since then, she's been very aroused by being physically hurt, or punished. So she's been sneaking out, going to places where she can meet people who also enjoy her same sexual fantasies. She has people spank her a lot. And she was whipped and noted that the orgasm she had was something she's never experienced before. She's came to seek help because her marriage is going to fall apart. She wants to change her husband's sexual preference. She says that he's done with her husband until he changes his attitude or he gets his act together, and he thinks that what she wants is not okay, and he's being very judgmental, so it's causing a very big problem in their relationship. So she said she's going to continue having affairs with men that will do the things that she likes until he decides to do them. For the multi-axial diagnosis, axis 1 is sexual masochism disorder, axis 2 is none, axis 3 is none, axis 4 is marital conflict, and axis 5 is a GAF of 80. The biological perspective for this client is, the theoretical perspectives are biological, so there may be a neurotransmitter imbalance. A deficit of serotonin has found to be associated with these sexual behaviors. When Carla engages in these activities, dopamine is secreted, creating a pleasure response, making the behavior more likely to occur. There is also the behavioral perspective. The client's symptoms may be due to a faulty learning experience. She may be classically conditioned because she is sexually aroused by this aggression. She may be operantly conditioned because the pleasure she receives is positively reinforces her to keep going because she feels pleasure when she does act on this behavior. And that's all I have for this client.